get a good picture of this, we wanted to visit different hospital setups. So we went to a Taluk hospital near Magdi, near Bangalore. And then we also went to a charitable hospital in Bangalore and a private hospital. So we were able to look at all these different spaces, right? And understand what are the kind of infrastructure they have and what are the different challenges they face. So what was actually prevalent was that stress was something that was ubiquitous among all the pregnant women, in regardless of whether they are in rural areas or urban areas, right? Whereas like the actual reason for causing stress would be different, of course, in different areas, but that was something that was prevalent and people were not addressing it. There were a few initiatives here and there, platforms where you can talk to other women as well, things like that. But there was no physical product that was catering to this. And when we actually went deeper, we understood that there was stress in terms of knowing if they are okay or if the baby is okay, because there are a lot of like physiological changes that occur in a woman's body when she is growing a baby inside of her, right? And you don't know what's happening, and it causes a lot of stress. So the key things we identified was that you need to provide that information, in terms of if collect some vital parameters to understand if they're okay. And the next thing was to have some kind of a temporary stress relief.
Hey everyone, welcome to Product Stories, the podcast that delves into the minds of product and design folks to talk about their stories, challenges, and work. My name is Kaushik, and in each episode, I talk to my guests about how they work, the process they follow, new tools, and the breakthroughs they have had in their career. This week, our guest is Deepika Gopalakrishnan, who's a healthcare designer and founder of dVerse Labs. It is a healthcare-based startup which started by building disruptive technologies to combat COVID-19. We take a deep dive into understanding how physical products are designed, how she took her product from 0 to 1, and what are the challenges of being a designer as well as an entrepreneur, and how she tackled them. This is a very inspiring episode, and I absolutely love the conversation I had with Deepika. So sit back and relax and enjoy this episode. Hey Deepika, welcome to Product Stories. I'm so glad we are finally able to do this episode. I'm super happy to have you here. Super excited to understand about your journey. We studied in the same college, but I never got a chance to meet you during our college days. But I would love to know your story now. But before, we dive into all the things that you have worked on and stuff, why don't you introduce yourself?
Sure. Thanks a lot for having me, Kaushik. I'm glad we're finally doing this. So I am Deepika Gopalakrishnan, and I'm a designer. Uh, so I enjoy designing physical products. I did my bachelor's in product design, after which I co-founded a startup called dVerse Labs. We are developing disinfection technologies to combat hospital acquired infections, and it started off during the pandemic, with the need that emerged then. And apart from running my startup, I also love illustrating, and I also enjoy mentoring school students through the design process, especially because I think back in school, I really feel like we should have design should have been introduced even while we were back in school, and I'm glad that that's sort of coming across now, with the change in the curriculum and all of that. But yeah, I these are some things I love to do. Yeah.
Awesome. So, the first thing which I want to discuss with you is that literally every guest that I have had on this podcast before you have all been someone who were digital product designers,
Mm.
and I am a digital product designer myself too. we have actually, I mean, I've never had anyone who is like a physical product designer. So I really want to understand, right? How is it different? What kind of challenges occurs while designing a physical product? Really want to understand the whole that area of that.
Yeah, sure. So, firstly, like if you look at the design process itself, like an overview of both the design process, it's similar, right? You are problem solving, you are doing user research, and then you generate ideas, concepts, you test it with users, and then finally you're implementing something. And then again, like it's a loop, right? So in that way, like overall, the design process, the approach is similar. But I think with physical products, you also need to have an understanding of materials, the manufacturing process, and then designing for manufacturability is a whole area of expertise that you need to gain, and understanding how different materials behave with each other, and things like that, right? And choosing the right material and the right manufacturing process to achieve what you want to build. And there's also like especially while implementing a product, a physical product, there's also the angle of serviceability that we are actually not majorly we don't learn that in design school, but having run a startup and having implemented a physical product in the real world, I've learned the importance of designing for serviceability. What that means is understanding what are some components that you can source that can be easily replaceable and things like that, right? And then like just also in terms of actually implementing your product, right? The time it takes and the cost that it takes to implement a physical product versus a digital product, I think there are many differences in that, and major challenges because it takes time to build something physical, but more than anything, it also involves cost. So, how do you fund yourself to even build the initial prototype or the MVP? I think with digital products, it's much faster. You have all the tools as well, and you can launch and you can get instant feedback from users as well. Here, it's also going about and you know actually like getting these customers to agree to. I mean, of course, that's there in digital products as well, but I think what I mean is like using a physical product, there are more barriers for accepting from the customers end. So these are like different challenges, and like when it comes to scaling, of course, right? I think it's much easier to scale in digital products. You wouldn't see a physical product scaling as much as a digital product. So yeah, I don't know if this
Yeah.
answers your question.
No, it
Yeah,
definitely does, especially the serviceability part and even the scalability part, right? I think
yeah.
the power of any digital product is that it's super super easy to scale.
Yes,
Like it's, I mean, you just have to. It's just replicating the lines of code, right? At the end of the day. Um,
yeah,
but coming back to your journey, right? So you're in like fourth year of your college, and I think this is when the pandemic hit. I think this
yeah.
was the last semester of college because I remember
Correct.
we graduated around the same time.
Yes.
How did the idea for your product come in? How did this entire thing happen? Just run me through.
Yeah. Yeah, sure. So yeah, like it was March, right? At that time, I was working on my thesis and doing an internship as well. And yeah, so actually, I've always been passionate about designing for healthcare and like creating social impact. That's been there throughout like my journey. Even in college, I would align all my projects towards creating some kind of an impact. Um, and yeah, so when the pandemic hit, right, I really felt driven to actually do something about it, because there was here there was like a real life problem that we had, and um, of course, like there was shortage of PPE kits, and the doctors were struggling. Actually, my dad is a doctor, so I was able to firsthand see all the challenges that he was facing as a frontline clinician. And yeah, just reading about it, I just felt like, you know what, I should really do something about it. And that's when I sort of got together online. Actually, we just connected online with my co-founders, and uh, we started this initiative called Open COVID, where we were building open hardware products. We were trying to make, you know, hardware, designing a product and then open sourcing that. That's what we were trying to do. And there we sort of built this product called Sterilo. After conducting user research and talking to multiple doctors, we understood that there is a need to disinfect common touch points within hospital COVID wards, especially because there were limited beds, right? And you could not actually move a COVID patient outside. Like, think about this scenario in 2020 when we didn't even know about COVID, and we didn't have any answers to or any signs of vaccines, right? So this was the kind of situation we were working with, and we developed Sterilo. It's a fabric-based sterilizer, and this won the MIT COVID-19 challenge conducted by Massachusetts, and that really, you know, boosted our confidence. And we were like, yeah, like designing is fine, but we really wanted to actually implement it and see it implemented in hospitals and create an impact, right? So that's when we started talking to doctors to understand what other needs they had, because this was an open source product and we were not very sure how we would be able to actually scale this, right? Because we've already open sourced everything, all the details of the design. So of course, there were other needs as well. So we identified that there was a need for disinfecting confined spaces, such as elevators and consultation rooms, and so on, in hospitals especially. So we started sort of tackling that challenge. We spoke to users, doctors, nurses, and then we sort of, you know, built multiple prototypes, tested it on field, and yeah, finally implemented the solution. Mm, yeah, so
So, I mean, what was the process like? Like, what kind of
mm,
challenges did you face? Because
yeah,
usually, like, when you're building a physical product, you you're more likely
yeah,
to, like, be in the same room and work on things.
correct.
And I mean, whether it is things like, looking at a particular material, looking at
Yeah,
uh, like all these things, right? How did you manage doing that? Like, via Zoom calls or
yeah.
completely online?
Yeah, yeah, that's a good question. Because yeah, like the major challenge was that, you know, I was in Bangalore, and then one of my co-founders, he was in Chennai. There was another person in Coimbatore. So all of us were totally spread out, right? And we had lockdowns as well back then, right? So we couldn't really like meet up and like build a product. So yeah, we had to basically like sit on Google Meet and then share our screen and literally make the entire model together, make all these decisions together. But we did take up different responsibilities as well. Especially when you're working in a startup, there are some decisions that have to be made very quickly, right? If you want to implement the product faster. So, for example, in terms of communication design and business strategy and things like that, I would take the responsibility for that. And then my co-founder, Krishna, he took up the responsibility for manufacturing, so things like that. And then Vivek was responsible for the technical part. So since we had our responsibilities like clearly distinguished, we were able to do it. And then coming back to the process, right? Yeah, so what we did was, yeah, so initially, like I mentioned, we spoke to the doctors and we identified the problem. And what we know, of course, like elevators are not just in hospitals, right? They're also in apartments, they're also in universities, offices, in any high rise building for that matter. So, but then when you are actually launching the product, you need to have some, you need to sort of narrow down, right? At least starting off to gain traction. And what we felt was a very strategic way to go about it is to make it a hospital grade product first. So if hospitals are convinced enough to use it, then that would also help us gain entry into other adjacent markets, right? Um, so we started focusing on hospitals, especially because the need was much higher there, right? Offices and everything as they were closed back then, so hospitals definitely had the need. So we started off with that. And so initially we made like very simple prototypes with just the electronics and then like testing it in my apartment elevator. So again, like we would just coordinate over Zoom calls, and then each of us would do different kinds of testing, right? So I was testing the electronic parts in my elevator, and then we faced challenges even in terms of the technical uh, aspects, and we had to like quickly change the sensors we were using and things like that. And Okay, so after that, once we had like the system in place, we conducted demos of the product in a hotel, in a hospital, and in PS University. Actually, I even set up the product there. So this was actually very helpful because we were able to, that was the first time we were interacting with the service technicians as well, who were helping us install the product, right? The elevator service technician, and we got a lot of insights even from the technician in terms of how the installation process could be made easier. uh, so we had to even make changes based on their feedback. So I learned that it's not just about like the users, but you have like a whole stakeholder map, right? And all of them can give you very valuable insights. And when we install the product in these different spaces, we also observed how people were using the product, right? And based on that, we had to make changes to the product to make it stronger. So yeah, so then finally we got hospitals to actually buy the product. It's called UVfy, and what it basically does is it disinfects spaces in the absence of humans, and it also understands the kind of interactions that are going on within the space, and accordingly sterilizes the space. So it's an autonomous disinfection system, and we use computer vision to actually track these human interactions. And you can look at this product not just being used in elevators, right? It's also now we are also looking at other spaces like consultation rooms, and hallways as well. Yeah, and then yeah, so initially like the traction that we gained with hospitals, that has helped us in also installing it in the Chennai metro now. So we've installed it in one of the Chennai metro stations, and we're hoping to sort of scale across all the stations there and in other
That
metros as well.
that's awesome. Congratulations on doing that. I mean,
Thank you.
that's like a step towards something big, I'm sure. Um,
Yeah.
so I'm just curious, like, how did you come up with the name for the product?
Yeah. So our product uses UV lights. So we wanted the name to be something very simple, and UVfy, right? So, like, I mean, in general lingo, you say you use the word phi, right? Like you just attach phi.
Mhm.
So we thought it'll be nice to say, okay, like, and most of the products that can be used as verbs, right?
Yeah.
They are the best actually. So like, let's just UVfy uh, this. Can you UVfy your elevator? Can you UVfy your phone? It can sort of just be expanded to anything. So we wanted it to be something simple to remember and also something that reflects what the product does. So yeah, we went with this. Yeah,
Awesome. So, I mean, right now you are doing so many things where you're working with, like, multiple hospitals, working even with the Chennai Metro, and I mean, so many things are happening, right? But I want to, like, actually go back to some of the early days. How did you actually manage to get some of the earlier hospitals? Is like my big question, because this is something which I always wonder about whenever I look at any product, right? The first thing that comes
yeah,
to my mind is, how did you convince, like, the first set of users to come and use this?
yeah.
And that's something I would really like to understand.
Yeah, yeah, sure. So our product UVfy is a B2B product, right? So you're actually pitching to managing directors of hospitals. And to be able to get to someone at that stage, you need to have contacts. So I think it's very critical. I feel like people don't talk about it so much, but it is important to have the right contacts, right? Because my father is a doctor, he was able to connect us with the right people. Um, and I think that's very important, especially for the early traction that you're gaining with your customers. So that those initial introductions really helped us to just directly talk to the managing directors. There were other hospitals or other hotels we reached out to where we started off with someone in the lower level and then moving, right? That takes a lot of time. And yeah, so that's very difficult. And besides that, we had to, get all the certifications in place. So we certified it at an ICMR panel lab. And then we also conducted microbiological tests on site to show them how effective it was. So before the disinfection happened, we took the swab, which would show, right, like, that there are these pathogens that are present, and then post sterilization, uh, how does that change? So those were some things that really convinced them. Basically, they want to know if it's effective or not, and if there is value for the money, right?
Yeah,
So yeah, so that's how we went about it. Um, yeah,
sounds great. I mean, I totally admire the the passion you have towards healthcare and, like, building products towards that. And there are so many things which you have been doing which has led up to this, right? It was not like, something that just
correct.
started, during COVID or something, but rather
Yeah.
something which you have been continuously working on, and that's kind of what it led up to. So
Mm.
on the same lines, right, you also have a research paper, and again, this is also related to healthcare. So I really wanted, I mean, I would be really glad if you could talk a bit about that as well.
Yeah, yeah, sure. So this was my third year design project that I took up in college along with Pramodini. Yeah, so there again, actually, that was the first time I realized that I'm so passionate about healthcare. I had worked unknowingly in a few healthcare projects like designing a wheelchair and things like that, but then this was the first conscious choice to explore this field further, right? Like healthcare. So yeah, so we started off by looking at the UN Sustainable Development Goals, and we were really like shocked to see that around 800 maternal deaths occur every day, and all of this is due to, like, complications that occur and that could have been prevented if precautions were taken earlier. right? And 98% of these deaths occur in rural areas, right? Um, and that really like shook us, and we just really wanted to dig in deeper and understand, right, like what is leading to these deaths, and why, if it's preventable, then why is that not happening? So that's when we went, and to get a good picture of this, we wanted to visit different hospital setups. So we went to a taluk hospital near Magdi, near Bangalore, and then we also went to a charitable hospital in Bangalore and a private hospital. So we were able to look at all these different spaces, right? And understand what are the kind of infrastructure they have, and what are the different challenges they face. So what was actually prevalent was that stress was something that was ubiquitous among all the pregnant women, in regardless of whether they are in rural areas or urban areas, right? Whereas like the actual reason for causing stress would be different, of course, in different areas, but that was something that was prevalent, and people were not addressing it. There were a few initiatives here and there, platforms where you can talk to other women as well, things like that. But there was no physical product that was catering to this. And when we actually went deeper, we understood that there was stress in terms of like, knowing if they are okay, or if the baby is okay, because there are a lot of like physiological changes that occur in a woman's body when she is growing a baby inside of her, right? And you don't know what's happening, and it causes a lot of stress. So the key things we identified was that you need to provide that information, um, in terms of the if collect some vital parameters to understand if they're okay. And the next thing was to have some kind of a temporary stress relief. So we came up with Shant. It's like a silicone based device. It measures their temperature and the heart rate, babies, the fetal heart rate as well. And from the pregnant woman's point of view, she just needs like very simple, basic information. She just needs to know if she's okay or not, right? So the interface is very simple for that. Just a red and green LED. So if there are any abnormalities, then she has to go visit the doctor. Otherwise, she's okay, and that's all she needs. But then the detailed report is generated and it is sent to the doctor's end. Um, and then we were also looking at, how would it be implemented? How can we, after understanding the rural landscape, we realized that midwives play a major role, ASHA workers. They are the ones who actually go and talk to pregnant women. And there are a lot of teenage pregnancies, right, in Indian rural areas. So there's yeah, they are not even prepared for this. So ASHA workers are the ones who sort of go and sort of act as an intermediary between the hospital and the pregnant woman. So we wanted to involve them as well. So the idea is to get them to go and give the product, and it would be used till the time of pregnancy, and then it could be returned back to the primary healthcare center and refurbished, and again, like using it in a loop, right? So we were also looking at the product life cycle and what happens after use. Can we sort of refurbish it, because it's mainly used like between those 9 months of pregnancy, right? So yeah. And then we got an opportunity to actually present this work at the International Conference of Research into Design. And that was a great opportunity. We really wished that we could have gone and presented it in person, but it happened last year through call. That was quite disappointing. But we did receive good feedback, and we're hoping still to implement this product sometime in the future. Both of us are very passionate about this. Um, yeah.
Yeah, I mean, it's just amazing how much, you dedicate yourself, whether it's in terms of research or whether it's truly understanding the person's or the user's problem, right? And
Mm.
really trying to come up with the solution. I mean, that's extremely admirable.
Thank
Um,
you.
and I'm just having a great time, just like listening to all of this, breaking down the problem statement and understanding the challenge and all these things. um yeah, I mean, it's just amazing.
Thanks, Kaushik. Yeah.
So I mean, continue on the same lines as challenges, like, I mean, you are still, like, in the phase where you're constantly tackling with them as a designer, as an entrepreneur, right? So
Yeah.
what is it like actually being an entrepreneur at this age, and at the same time,
Mm.
um from going from being a designer to being an entrepreneur, like, how what were like the challenges that you faced? How did you tackle them?
Yeah. So, yeah, I think as a designer, right, you always have this mindset of making things perfect and like getting into the details. I'm sure like you resonate with all of these things. So,
Like a
I
common
mean,
thing which every guest kind of brings upon, that designers are obsessed with perfection.
oh my God, we totally are. Yeah. And like as an entrepreneur, you need to be okay with like not perfect things, right? Because you just launch, you see how people react, and then you get back to making things better. Perfect is very difficult to achieve if you're an entrepreneur. You will never be, of course, even as designers, you're anyways never satisfied. But then, you have to be okay with like super imperfection in order to get things rolling, right? So that is something I had to really like unlearn as a designer to be able to actually like launch something on field, right? And I realized actually that that's also helpful for designers, because once you let go of that super perfect thing, you can quickly launch, see how people react, and then get back to making it better. So I think this is something I'll take away, like just generally in terms of like modifying my design process also. And yeah, as an entrepreneur, you have to be willing to do everything. Like I've sat and looked at my accounting Excel sheet and like tallying each and every bill with that, talking to auditors, like super boring tasks, especially like as a designer, like you are a very creative person, right? And staring at these Excel sheets, it's just very boring. But then you just got to do it. There's no option. And especially because we're building a physical product, right? There are a lot of materials that you purchase. So there's just a whole lot of things when it comes to accounting. And then apart from that, also writing grants and communicating the work that you're doing, right, to win grants. I think that's been very helpful in general in also improving my presentation in terms of like how I communicate about my work visually and verbally. Um, because as an entrepreneur, you really just need to be out there and like you're just pitching all the time. I go attend like some function, and then people start asking me what I do, and then I just start pitching about the product, right? so so yeah, that's been another thing. And yeah, like you are constantly talking to customers, pitching, and then like apart from that, you also have to do marketing, social media, and like just put yourself out there, because otherwise no one's going to actually like see you and like yeah, so I think those things are very important. But then some of the challenges we faced was like also in terms of gaining credibility as a as as an entrepreneur, right? And so in my team, I have two people who are much more experienced than me. They have 3 4 years of experience, so that really helped me as well, right? Because I learned a lot from them. So I think like if I had started with people uh, who were my age, like it might have been very different, the journey altogether. So that way, actually, this is what made me more confident as well to start this, because I knew that I would be, gaining a lot of mentorship also at times from my co-founders. So that was very helpful. And yeah, like in terms of gaining credibility, right? We face challenges in that, especially because our product is not patentable. So that is something we didn't uh, anticipate, in the sense we just wanted to quickly launch this product, right? Because there was a major need for the product. But then since it is not patentable, it was very difficult to raise money. So then we had to go the other way around, where we bootstrapped and then we launched the product, gained early traction, and then we showed those results in order to raise money. And now we won grants. We've also been incubated at IIT Madras, also by Nexus, which is run by the US Embassy in Delhi. So yeah, our journey was quite different, especially because it was in the pandemic. Um, yeah.
I'm sure it sounds extremely challenging in itself. Um, but one thing I don't know about other designers, but I do, and I really enjoy working with Excel sheets. Uh, I
Okay.
I think I'm probably just an outlier, I guess. But yeah, I mean, your entire journey sounds extremely challenging and extremely wonderful. Um, I can't believe, like, how many things you have achieved. I mean, so quickly and so soon. But I mean, it's really great that you have done, and especially uh, with keeping. I mean, the vision of what you're trying to do is to ensure to, like, improve healthcare and all these things, right? It's just sounds wonderful.
Thank you.
Anyways, we have pretty much reached the end of the episode, and I usually end my episodes, like, by asking us a few set of rapid fire questions. So if
Sure.
you're ready, we can get started. Okay, awesome. So my first question. So you have worked on a lot of projects, right? So I want you to pick, like, your favorite project among all of them.
Okay. I would definitely pick UVfy. It was a very transformative experience for me, because I learned, right, like how to design a product, but also how to implement something in the real world, something that's very close to me. So yeah.
So one designer that you really look up to.
Hmm. So I really look up to Neri Oxman, and also Krista Donaldson. Um, so Neri Oxman, she dabbles with materials, biomaterials, and like just thinking very much into the future, right? She used to work at the MIT Media Lab. She had her own lab there. So I really find her work very inspiring. And yeah, Krista Donaldson is someone I came across quite recently through a podcast that I was listening to. It was a healthcare design podcast run by Bon Ku, if you've heard of him, the Design Lab podcast.
Okay.
So she runs this organization called Equalize Health, and they have really like scaled the product that they have built. It's a newborn. It's a device for newborns phototherapy device, and they've actually managed to scale and like impact around 1 million newborns. And her whole journey is very inspiring, and I resonate with a lot of things that she's done. So I really look up to her. Yeah.
If if I had to say the same thing for an entrepreneur, who is it that you really look up to?
Entrepreneurs. Again, I would say Krista Donaldson
Okay.
for sure, because she is a healthcare designer who also she's the CEO of her company, and she's actually like scale. It's very difficult, especially in healthcare, because the adoption rates are very low, right? Like they are not open to change, especially in the hospitals. They are used to a certain way of doing things. Sometimes they don't even admit, the
Yeah.
challenges that they face and things like that. It's very difficult to gain insights also from it. So, and then launching a product, they're convincing them to use it. I think that's a very difficult task. I've experienced it myself, and yeah, it's very inspiring to see. And especially because she's a woman, right? I really look up to her because there are many challenges and stigmas. Like, I mean, of course, things have changed, but there are people, like you walk into a room and there are people who will ignore you just because you're a woman. That still happens, especially in the startup world. Um, yeah. So,
Yeah, I'm sure. I mean, I basically had like an episode just before this where I talked with one of the guests purely about um, about diversity, having diversity within a team, and how you can make like a workplace inclusive. All these things. So all these points are brought up throughout the episode. So yeah, I can completely relate to it.
yeah, yeah.
So coming to my next question, this is like a question which I've been asking pretty much every guest who comes.
Okay.
So if you had to literally worry about like nothing, whether it is like money, career, or whatever, right? Any of the constraints that are there for us, what would you actually be working on right now, or what would you be probably doing?
I think I would still be interested in healthcare because I'm very passionate about it. And like, there are so many challenges in healthcare, yeah, where, you need interventions, you need something to happen. So if I had no constraints, I would just happily be designing actually. Like, I'm more passionate. I've also realized that I'm more passionate about design than like the entrepreneurship part of it. Although that's something I have to do if I have to see my products implemented, but if there were no constraints, I would just be happily like just focusing on designing uh, healthcare products. So yeah.
Awesome. So coming to my last question. So as a startup founder, you were even mentioning this, right? That you wear multiple hats, whether it is marketing, all these things, right? So which one of these do you enjoy the most?
Yeah, I think I answered this previously. It's definitely design.
So if
And
if not for
yeah,
design, what other things do you enjoy?
I enjoy. I have to think, see, because design is what I love the most. But then, if I had to choose, I would say like marketing. That's also something that I enjoy, and like strategy, marketing and strategy. Uh, because thinking strategically how to place your product, how to convince clients, and also uh, various grant agencies. Yeah, that's something I've enjoyed doing as well. So yeah.
All right. Cool. We have reached the end of the episode. Thank you so much for doing this. And after scheduling multiple times, we were finally able to do this. This was like a very refreshing conversation on a Saturday afternoon. So I thoroughly enjoyed this episode and this just talking with you. I hope you did too.
Yeah, thank you so much, Kaushik. I really enjoyed our conversation too. Well. Thank you for having me. Uh, I really like that you gave me a chance to, share my journey and share what I'm passionate about. And I
I
hope
mean,
the listeners
the
also
the
enjoy this.
the way I look at it, I'm thankful that you're taking time out to come here and talk about all the things you've worked on. Yeah, that's it's probably the credit probably more goes to you than it's to me. So yeah.
I think it's a two-way thing. So thanks a lot, Kaushik. And I'm glad we finally, I guess, like after our college days and everything, we finally got to have this
Yeah.
conversation. Yeah, thanks, Kaushik.
Thank you so much for tuning in. Make sure you like, share, and subscribe to Product Stories for more such episodes.